Welcome to The Aesthetic Effect, a podcast where beauty meets innovation. Your host is Flavio from Fiore Aesthetics.
Welcome to the new episode of The Aesthetic Effect, my podcast. I'm Flavio, your host, and today I have a very exciting episode actually. I'm interviewing a very well-known face within the medical aesthetic industry, Dr. Zunaid. So without further ado, let me introduce you to him. Here he is. How are you?
Hi, I'm very well, thank you, Flavia. How are you?
I'm really good. Thank you so much for agreeing in obviously doing this. I know how busy you are with your clinic, with your training, with your with everything. So thank you so much for taking the time. So how are you?
Very, thank you. You're very welcome, and thank you for letting me onto your podcast. I hope we can share some knowledge and some insights that can help our listeners. So I'm very well, thank you. A bit gloomy outside this Monday in London.
But I'm hoping to learn something new from you, because obviously you're not just a practitioner, but you're a well-known trainer. So if I can get some bits myself from it today, it would be amazing. So let's let the listener what you do.
I practice medical aesthetics and wellness. I've done it for about 10 years. So it's sort of ever since I qualified, and I did my basic training in South Africa. And then I moved to the UK in 2014. I started my aesthetics journey in about 2013 in South Africa. How I started was actually by doing minor surgeries, which I really liked. I worked in a GP practice. We were really busy. And then I covered my colleague during maternity. And then she said, you have to do Botox and filler on my patients. And I was like, I'm not really interested, because the courses back then were really expensive. So she said, fine, I'll pay for the Botox course, you pay for the filler course, but you kind of have to do it if you're covering me. So that's basically how I started. And I really liked it. I liked the science behind it. And I liked what effect it could actually give patients. And I think that's kind of where it started. So I've worked many jobs in medicine. I've worked general medicine. I did a minor fellowship in medical oncology. I worked in A&E. I worked in trauma and general practice as well. So it's a nice kind of well-rounded way to kind of get into medicine, really. And we all do that as junior doctors. And the aesthetics just kind of came along with me from the time that I was a junior doctor.
And I think you just finished something, if I'm not wrong. You just finished a master. I saw you like on your graduation day with this wonderful coat and hat. You look so handsome there.
Thank you.
I think you just finished off some master degree on
something
lately. I know, just to add on to your CV.
Yes.
Amazing.
Absolutely. And that's, with medicine as a whole, you never stop learning. Just when you get the basics is when you really start to hone your skill and learn more and more. And medical aesthetics is a very, very fast moving specialty. I thought oncology was very fast moving, but it's nothing in comparison with medical aesthetics. So there's something new virtually every week, every 2 weeks. And it is our jobs as practitioners to work out the treatments that are efficacious, which means clinically effective, versus the treatments that may just be gimmicks, that may potentially be unsafe for our patients. So there's a lot of behind the scenes work that goes into a medical aesthetics clinic. As I'm sure you know, it takes a long time to hone your skill. I see every procedure really as a minor surgical procedure, even if it's something like doing 3 areas of Botox, which you've done many times over. There's always something that new that you're going to learn, or the patient's going to present maybe slightly differently. And that's very, very important. So yeah, keeping on top and keeping your knowledge on top takes a lot of time.
You just touched a really good point there. So how do you kind of custom made, or how do you tailor made? What is the most important, would you say, bit of from meeting a patient to actually bring this patient to that journey? How do you tailor made or custom made, or how do you take your patient from here to there? I mean, we know that everybody's very different, so we can't treat everybody the same, right? So what is your approach to explain your patients how to go from here to here?
So first and foremost, it will always start with the consultation. But there's something important that we do call the pre-consultation.
Right.
So this is something where you might, if a patient knows or they have some idea of what treatment they might like, you can send them some information, just so that they can maybe do a little bit of reading before the consultation. And then during the consultation, we can do it in one of two ways. So we do either a video consultation, but that must be followed up by a physical consultation where we actually examining the patient, and it must be done face to face. So if we do it over video, it's more of an information session, just kind of giving the patient a little bit of insight into the treatments that they might be wanting. And then when they come into clinic is when we do a very, very detailed consultation and an examination. So this is essentially making sure that what the patient's main concerns are, you're able to address with the treatments that you offer on your treatment menu. And this is absolutely crucial because for some patients, they might see something on social media and think that perhaps it's suitable for them. And it's not always the case because in aesthetics, and you can definitely tell me this, your results are absolutely outstanding. And the reason is because you would probably, like me, take your time to just explain what can be done with a particular treatment or treatment modality. And, always in aesthetics, even when teaching, I always say the aim is to under-promise and over-deliver. And that is absolutely crucial. So, for example, somebody will see a treatment online and they'll, like, for example, let's say something simple like Profilo. But what they've seen doesn't really tie in with what the treatment really is and what it can do. Like most patients are quite shocked when you tell them Profilo has to be done in 2 steps. You do your first session, your second, and in some patients you can even do a third and a fourth. So you have to dispel a lot of myths and lots of rumors, lots of misinformation, and just kind of bring the patient onto the right path. Tell them if that particular treatment, like Profilo, for example, is suitable for them. And then I am a big fan of the cooling off period. So I let patients, irrespective of whatever treatment it is, just give them enough of a chance to kind of digest what's happened in the consultation. Absolutely. And then you can build your treatment plan from there. So sometimes it's a 3-step or a 4-step treatment plan. So for example, sometimes we'll start with toxin and then we'll move on to filler as part of the treatment plan for rejuvenation. We'll then follow that on with some skincare treatments, for example. So this is how you tailor make absolutely everything to what the patient's requirement is. So I let the patient lead always. Exactly, like what bothers you the most, or what would you like us to address today, or what would you like us to address first? And that's the way we kind of open it up so that it becomes more of a dialogue rather than you request something and we do it and we don't get a good result.
Do you find as well that these days the expectations from patients in general, because of social media, because of the information that patients these days have, right, through Google, and we go back to social media, do you find the expectations are becoming quite unrealistic? Not to an extent, but how realistic, when you see patients in your practice, do you come across patients where the expectations are so realistic that you have to kind of re-educate them from beginning and say, this is not happening, that is a filter on social media, that picture is being retouched, you're not going to look like that by doing this. So how much re-education you have to do with your patients, not students, but with your actual patients?
So patients. So it's quite a lot. So you hit the nail on the head there. And I think that when patients tend to see a before and after. Now, befores and afters can be very, very misleading. Like, for example, threads. You see a before and you see an immediately after. And this is something that we do as well when we put it up onto our social media. But we know that with threads, your process of collagen stimulation and tightening of the skin only happens at 12 weeks. So it's a 3-month-long process, but the patients would expect to see a result immediately, which they do. But we then walk them through the entire process of the 12 weeks, which is really what a lot of people don't show. They don't show the before and then the 12-week picture, which is really the most realistic. So I find that there's a lot of education that needs to go into the consultation with the patient, and giving the patient something that is usually either via email or perhaps a brochure that they can read that comes from the manufacturer themselves, I find is quite reassuring for the patient, because that way they know which brand is being used. Yeah. They can actually do their own research and see what the company is like, and also what kind of support there is if something goes wrong.
Absolutely, absolutely. And would you say, like at the moment, obviously there's quite a few there's quite a few trends going on at the moment. Which one would you say is your favorite, if we want to call it as a new treatment, for example? Which one would you say is something that is valid, is something that you can see staying for a long time? And what would you say that is something that everybody's talking about, that in your opinion you're thinking, this is only going to be around for probably like a short period of time?
So I'll be honest with you, it's actually skin boosters. Okay, if I had to choose one, it would be skin boosters, and I'll tell you why. We've been doing skin boosters since 10 years ago. So it's nothing new to me, and it's certainly nothing new in my practice. It seems like the rest of the world is now catching up. You're having a little bit of a movement away from the overfilling effect. So again, this is nothing to me. I've never overfilled patients. And if you get to the point where you're using 6 or 7 or 8 mils in one appointment, you have to really be thinking. I mean, I only use premium fillers. I only use stillage, because you need to use significantly less to get a very, very good result. It's a superb filler. I'm not touting the brand because I'm their KOL. I have it in my own face.
Yeah.
So if it's good enough for me, it's good enough for my patients, because I ask a lot of questions before treatment. But coming back to the skin boosters, they are kind of really very much here to stay. And I think now that everyone is actually getting into the, understanding the power of skin boosters in skin regeneration, now people are kind of like, well, yes, we do the filler to do the deep structural work, and for volume replacement, nothing replaces or mimics bone like filler does. So your deep fillers essentially still very much has a place. But when it comes to looking after the quality of the skin, it's your skin boosters. And a close second to skin boosters are things like skin acid treatments. So things that skin acids that actually stimulate collagen. Yeah. So we find a lot of patients, the focus is now shifting a little bit more towards skin and skin quality, which it should have been like that from the beginning. So I think those are the trends where we are going to now. The other third trend, if you allowed me one, I've given you 3.
Oh my God, please. Absolutely. I'm enjoying this. I'm learning. I'm actually myself. Yes, go for it.
Amazing. The third trend are actually kind of our regenerative treatments, or our true collagen stimulators. And under that umbrella, you're looking at things like polynucleotides in combination with hyaluronic acid, and the two work very, very well together. So these are your biostimulators, these are your collagen stimulators, and then you have the added benefit of the hyaluronic acid. And this is the thing with most companies. Companies get really, really clever in their research and development. So when they look at a product that they are going to make or manufacture, they look for that unique selling point. They look for that one thing that would make their product stand above other products. And of course, then in vitro, when you inject the product or you place the product into the skin, it's then got to be able to perform. So I think that is kind of where we are going to stay for quite a while at the moment.
Which is good, in my opinion, by the way. And what about, another thing I'd love to hear from you as well, what about exosomes? What is your idea on that? Do you think it's something that is too new? Are we going to have to, within the aesthetic industry? So what's your idea on that? What's your idea on polynucleotide exosomes, and use them, for example, for hair growth? I was reading actually a paper a few days ago about hair follicles, how effective they are. when you use them for hair follicle regrowth or stimulation, so on. So what is your opinion on them?
Okay, so they work? Yes. If the quality of the product is right, it will work. So the difference for our viewers between exosomes and polynucleotides is essentially your exosomes are very, very, very small, tiny microscopic nanoparticles. So as a result of that, you can't really inject exosomes. I'm told that there are injectable versions that will hit the market later in the year, but for now, they are usually very superficial treatments.
Yeah.
So you either microneedle them into the skin and into the hair, for example. You can use them around the eyes. They are very, very good at producing collagen and elastin, particularly in the upper layers of the skin. Your polynucleotides, we used to have ones that we used to have in mesotherapy cocktails, which essentially came from salmon or from salmon sperm. And these are slightly larger molecules of polynucleic acids. So these now, we have lots of good manufacturers in the world. So they now come in a gel formulation. In a syringe, it looks like a filler. It doesn't give a filling effect. It gives a regenerative effect. So those can be injected a little bit deeper. Now, those we inject in the face, we inject it absolutely everywhere. You can inject it into the genitals. There are new treatments for the vagina. You can inject it into the skin around the penis. You can inject it on the face. You can inject it under the eyes. You can inject it in the hair. And what they found is that essentially it does accelerate your anagen phase. So it makes the phase a little bit shorter. So you do get slightly more rapid hair growth with it. Now, along with that, let's compare that, for example, to PRP. So PRP is a stem cell therapy, but it's what we call autologous stem cells. So basically, we know that platelets are very pluripotent cells. They have lots of different functions aside from clotting. And when you activate them in the tube, essentially, and you take out whatever you need to take out, you can inject your own stem cells that your body has made, and particularly into the hair. So we see patients, I see lots of patients, like we talk about turkey teeth, I call it turkey hair, where they go and they have either FIE or FUE hair transplants, and they come back, and those patients come back after having a transplant. Now, Turkey is one of the world leaders in hair transplants. I will tell you that. For myself, if I wanted to train as a hair transplant surgeon, the best places in the world to train would essentially be Mumbai or Turkey. They're really, really good. But when patients can't really stay in Turkey to be having 3 sessions of PRP, because they are essentially done 30 days, so 1 month apart, for about 3 sessions after a transplant. I see lots of patients who come back after having their hair transplants in Turkey. So we do either a combination of either PRP or polynucleotides in the same session. Depending on the degree of or the number of follicles that have been implanted. So it's very, very good for hair growth. We tried it. We tried it on myself, for example. I had it injected all the way up the hairline because I was starting to get a bit of the widow's peak. I have very, very thin hair. And of course, I had it in my crown because that was also kind of getting a little bit sparse.
Was it the PRP or polynucleotide?
No, it was polynucleotide. So
right.
the brand.
Would you inject polynucleotide and PRP together? Meaning, like, would you mix them together, or would you do it an injectable as PRF or PRP, and then would you inject polynucleotide straight after?
Exactly like that. I don't really mix them because there are other issues like pH and things like that, and also your PRP solution, your platelets are quite fragile. There's platelet fragility, so you don't really want to be overdoing it where you just deactivate the platelets that you've worked hard to activate. Yeah. So one after the other. Patients will be watching this, so just that they know what to expect. After those injections, either PRP or polynucleotides or both, my patients don't wash their hair for a minimum of 12 hours. go to sleep with it, and then the next morning just plain shampoo to kind of wash them. They might feel little bits of like bumps in the hair on the scalp, but that is entirely normal.
Amazing. Do you know what is your for the listeners? Like, it would be really interesting if you could explain maybe the difference between polynucleotide and a simple, not simple, let me rephrase it, and a traditional HA-based hyaluronic acid, so like a Profilo or any other skin booster. So a lot of people at the moment, there's a big confusion between, polynucleotide and exosomes and and a traditional Profilo skin booster. So can you explain all the viewers and listeners what is the difference between polynucleotide and just a traditional
HA?
like HI skin booster?
Okay, so firstly, the main similarity between them both is that they are both collagen stimulators. We now know a lot more about hyaluronic acid. We used to think about it in terms of the fact that you just injected the HA, it drew moisture from the tissue, and essentially that's what caused the plumping effect in the skin. But now we know that there are certain clusters of differentiation within the tissue, and there's certain biomarkers that are activated by injection of hyaluronic acid. So hyaluronic acid does have a collagen stimulating effect. It gives a plumping effect, so it plumps within the confines of the skin or within the confines of the layer in which it is injected. So you don't inject a skin booster all over the face and then kind of have your whole face puff out, which is the same thing with Profilo as well. Profilo is made slightly differently, but it's a very, very high hit of hyaluronic acid that when you inject it in a very specific layer of the skin, it will diffuse a 4 centimeter, 4 centimeter, 4 centimeter, 4 centimeter, 4 centimeters. So it just kind of, it gives I'm going to be careful here and say a plumping effect. It doesn't give a filling effect.
Absolutely.
Then you are also looking at Profilo in the face. You are confined to the middle third. So that's upper third, middle third, lower third. You're confined to the middle and lower thirds. You can't put Profilo near the eyes, and you certainly can't use it in the forehead. Whereas now you're looking at your polynucleotides. Your polynucleotides are they are true biostimulators. So most of them will come from either salmon sperm or they'll come from some other kind of marine source. The reason is
trout as well. This is
trout as well. But it doesn't. It's because of the high numbers of the sperm. Essentially, carries a lot of the nanoparticles of the polynucleotides, and so it's synthesized from there using a pharmacological process, and then this is essentially injected into the skin. So it has the properties of stimulating collagen and elastin superficially, and also you get different types. The brand I use comes with quite a high percentage, which is a general one for the face, and then you get slightly lower doses for under the eye and for the hair. Now, it's quite forgiving in terms of the fact that it doesn't give a filling effect. It gives more of like a smoothing effect, especially when used under the eye. And I think that's where it's really taken it forward. Because when it comes to tear trough filler, there are many, many patients who are not suitable for tear trough fillers, where you just know when you assess them that if you put in any filler there, you're just going to create a lot of problems and a lot of puffiness. So you actually make it worse. So with polynucleotides, you can inject it into these regions, and what it does is it actually stimulates collagen and elastin around the eye. The other thing that's really good about polynucleotides is that essentially you can inject it with a cannula. So you inject it into the kind of like the superficial layer of the dermis, which you could very easily do with a cannula, a nice thin cannula. Or you can bleb it, so you can inject it with a syringe and a needle like a normal mesotherapy product. So it does have those kind of additional benefits, and it's quite forgiving. But there's no benefit without risk in medicine, and especially in aesthetic medicine. So one of the problems with it is that we must prepare our patients for at least about 48 hours worth of swelling. And sometimes that swelling can be quite profound because it's such a strong and potent collagen stimulator. So that's why you find, especially around the eyes, I had one session, I'm due another session. As you can see, a little bit of the dark circles and the crepey skin is starting to
You're looking good.
to affect. So I'll have a second session there in about a week.
Actually, I was just about to ask you a question. I was just about to ask you, what is your favorite treatment? What works for you? Because we know that everybody's different. So what works for one person doesn't work for other patients. But what works for you? What is your favorite treatment or something that you love doing?
Okay, so I'm very basic. I don't have a lot of time to be on the bed. Let me just tell you that. Even just having a hydrofacial is such a problem just to get on the bed. So I'll probably have Botox maybe about twice a year. I don't like, for me, this is for me. I don't like kind of over treated, because when I animate, I tend to raise my eyebrows. So if it goes a little bit too heavy here, I have weak muscles on the side here. So what happens is, if you look at my brow, this has happened before, where it literally I end up looking tired, can't open my eyes properly, right? So I have it here, have it there. I'm a big fan of PRX. I just had on a teaching session last week, Wednesday, we were model short, so I got on the bed, so I had a PRX session. I had my tear trough fillers dissolved. And the reason is because, not that I'm not suitable for tear trough, but it was the wrong grade of filler and it was the wrong filler. It was done about 5 years ago, and I had come back from traveling about 4 days. And this is about 5 years after it was injected, my partner looked at me and said, "Why are your eyes so blue underneath?" And after 5 years, just completely out of nowhere, and then it actually started giving a bit of a Tyndall effect. And when I looked up at the ceiling like that, I was like, and I looked and I took a photograph, I was like, that is actually Tyndalling. So I had that dissolved. And I thought, I want to know what it feels like. And I also want to experience the regenerative effects of polynucleotides. I know it works in the hair because I had it injected into my hair. I want to see what it actually does under the eyes for myself, because, there's a little bit of hollowness, but there's kind of like dark circles underneath the eyes. I also have really awful hay fever. So that's why my eyes always look a little bit, kind of like a little bit puffy, more puffier than normal. Then I've had filler. On a training day, I've had a bit of filler in the nasolabial. Oh, and I have absolutely no problem sharing this. In 2022, I went on to Ozempic. I was properly assessed and it was properly prescribed and all of that. And I lost a lot of weight, but I had lost everything from the mid-face. So it just kind of all kind of sagged down. So it was just kind of looking like that. So I had some filler done in the deep malar fat pads. And that's pretty much it. I like skincare because my skin never ever looked like this. I grew up in Africa. We never wore SPF. It was something you bought when you went on holiday.
I'm Italian, so and I'm 47, right? And I'm Italian, so growing up in Italy, like especially when I was 15, 16, 17, 18 or whatever, the truth is that we didn't know what SPF was, and Italians, they love a sunbathe. They just love it. So I think this is something that now we know how. I mean, we all love it, sunbathing, but the truth is that now we know the damage that creates. But your skin looks, actually, I'm looking at you on camera, you look really, really good. So whatever you do, you're doing amazing. So that's good. But listen, I've got another question for you, and I would probably say, what would be your advice to all the listeners and people that are watching this podcast? Number one, how to choose a practitioner, a aesthetic practitioner, medical aesthetic practitioner, and two, how to approach. I think sometimes, we live now in this society where a friend has a treatment, so somebody else, is telling them, go and have it. This is going to be amazing. Did wonder for me. What is the best thing that you will say to someone when they come in and they go, my friend had this treatment done and I want this done myself? And what is the best advice that you can give someone out there when and how to choose, a very good aesthetic practitioner, really? Just to be safe. questions in
Two
one.
questions in one. Okay. The first thing is never feel shy to ask your practitioner what their qualifications are. I welcome it. Any practitioner worth their weight will never be offended. So just always ask, how many of these have you done? What's your experience? Do you get good results? Can you maybe show me some befores and afters? So I have a lot of pictures that need to go. My Instagram is absolutely awful. There's a lot more that I've got about 16,000 pictures that need editing and posting.
Wow.
So that to give you an idea.
Wow.
But I also have an internal portfolio where patients have given me consent and I can show a particular picture, but I show it in clinic. So it doesn't, I can show it during a consultation. So that's my own internal portfolio, which I find very, very helpful for patients. So it's all, how many lips have you done? How many smokers lines have you done? What's the effect of PRX? What happens after threads? So there's, you have that, and it's a good conversation point for your patients. So that's the first thing. Don't be afraid to ask their qualifications. Number two, and along with that, it's very, very important that we build in for us as practitioners a contingency for should things go wrong or should things not go according to plan. And this is important. And the lines of communication between us and patients have to be open all the time, because I really don't like it when patients, and I've become a little bit strict on this, where patients have a treatment with us, we give them their aftercare information, but then they might meet a friend or they might Google something. And if you're not sure, you ask us, because we performed your procedure, not Google. So, and I'm very, very strict on that. And if perhaps they feel that they want to trust Google more than medical advice, then unfortunately those patients don't get treatment with us.
Absolutely.
So the second part of the question
was, what happens if someone walks through your door and they are like, I really want to have this treatment done because my friend, my cousin, my brothers and sisters, someone had that treatment, and that treatment worked fantastically for them. This happens to me often when someone comes through the door and they're like, oh, my sister has done this treatment, I really want to have that done. So what would be your response to that? I mean, how do you, especially if you think that that specific treatment would do nothing for them, So how do you go around that? How would you take, what do you do to direct them to the right path?
Okay, sure. So it's important. All patients that come to us will have a consultation. And this is very, very important that patients understand that we have to, and part of the consultation is to assess suitability for a particular patient. So you'll have like a treatment, maybe like a skin booster, a superficial skin booster, or you might have a treatment maybe like a skin acid peel. But it might be suitable for one. So for one patient, they might see a good result after one treatment, and for that particular patient who's inquiring, they might see a good result after 2 or 3 sessions. So it's important to just be very open and honest with patients and say that sometimes, well, most of the time in aesthetics, it's not really a one size fits all. So, and I think my opinion certainly is when patients come into clinic, that they understand that it might work differently in their skin in relation to their friends, for example. And the biggest thing I see with this is actually in lip fillers. So, a patient might have a lip shape where, you don't have to do that much. Just this very simple linear threading technique, and the lips just pout out and they look amazing. And then you might have a patient, the friend, who might come in and say, oh, you did her lips really, really well, but this patient might have M-shaped lips or very, very thin lips. And nothing that you're going to do is actually going to give them the result that they desire, that their friend might have. So also understanding and explaining anatomy is very, very important. And also, differentiating different subtypes. For example, cheek filler. Another example is tear trough filler. So you might, on one patient, they might have really, really good mid-face cheek support, and you can go straight in and you can do their tear trough fillers and you have a beautiful result. And sometimes you have a patient, maybe their friend, that will come in with them and say, wow, she looks so much more awake and so much more alive, and the dark circles are so much better. But with this patient, you might have to actually put volume back in the patient's cheek first and then do the tear trough as a second treatment. So it might create a little bit of a gray area, let's put it that way. So, they might think, you're trying to make a little bit of extra money off them, or, why did she have it and I can't have it, that kind of thing. So it's a delicate area, it's a gray area, but you have to explore it with every patient. And this is why the consultation is just absolutely vital.
The funny thing is that the way that I normally approach that is always, when someone comes through my door, I always say to everybody, we're all different. So let's talk about you, and that's normally it's how I start, as soon as someone says, my friend referred me to you and, she looks incredible. I want the same, I always say like, you're you. And your friends is a different person. Let's talk about you, what we can do for you. Because you touch a really good point. It's about anatomy. It's about, the beginning where we start. Not everybody looking, the anatomy is completely different. So you can't recreate something that you've done on A to B and C and D. So everybody's really unique. So I think we should really make sure that people understand the aesthetics is unique, and everybody, we can treat someone with the same treatment, but not everybody will have the same results, because how you respond to that, it's about your body, your anatomy, really. But listen, it's now nearly time. It's nearly 40 minutes. We have had such a great time. But I just wanted to say to you, thank you so much for agreeing doing this. I've learned so much talking to you today.
Thank you.
It was such a pleasure, because obviously we see each other on Instagrams and things like that. I know of you working with the and big names, and I always thought I'd love to meet you one day and just go out for a lovely coffee and just have a lovely chat. But not now.
Just so our viewers are very, very clear, we have admired each other's work. We have crossed paths in a virtual space. This is the first time I'm actually speaking to Flavio in person, and we have not met in person. So when we do meet in person and we go for that coffee, it is going to be very well worth it.
And do you know what is funny though? Like this is absolutely the truth. Yes, I was thinking, should I maybe give him a call, or should I just video just to maybe like meet each other before actually do an interview of this kind, But then I thought, you know what? Probably not. Because the genuinity, if that's the right way of saying it, the reality of actually meeting each other for the first time, actually face to face, and have this conversation, I thought was actually quite nice. So I thought, no, I won't give him, because I thought maybe a video call would have been just to break the ice but I just thought, no, do you know what? Let's do it on camera. It'd be amazing. Then again, I admire your work, and I know, what you do is phenomenal.
Same. Absolutely. It's really why I kind of agreed to do this, because obviously when I watch your stuff, you're really incredibly passionate about skin. You work with Professor Amore. I mean, these are people who, they may not necessarily be on the forefront, but these are people who are doing very important work in our industry. Their products are good, they're outstanding, they produce results, and you're very passionate about it. So that's why it was an absolute no-brainer.
Thank you. So I just truly, when someone says to me, I had a few people over this weekend, and I never met before. It was my husband, actually, colleagues at work. Anyway, he brought someone home, and his wife and everything. We were having a lovely chat, and then she said to me, like, I love what you do for work, and it's incredible, and blah blah blah. And then actually, she said to me, would you see yourself doing anything else apart from what you actually do? And I tell you what, honestly, I am so lucky and privileged. I know it's going to sound so probably a little bit cheesy as well, but I am so incredibly privileged to do what I love, what I feel I was meant to be doing. I just love this industry. I love what I do. I love to keep myself occupied in a sense of studying. I'm doing something now, which probably we talk about it not on camera, and I'm going to Italy in a few weeks to spend more time with Roberto Amore, and so I just love it so much, and that's why I think sometimes things translate into probably videos, and so because this is for me is not just, this for me is my life and what I was meant to be doing.
Absolutely. And I always think about people who potentially never get to do a job that they love, and that's why it's good to just pay it forward. Just be a good human, because you're lucky. I'm lucky that I get to do something I absolutely love and adore. I mean, it's really, really busy. Sometimes I just need my head to just stop for 5 minutes, but I wouldn't really have it any other way. So, we don't need to be told to be kind. Just be a good human. This is your craft. Just work to the maximum. Do the best for your patients in every circumstance, and you'll never have a problem.
But just one last thing I want to say on this. It's actually quite nice to when I spoke to a few people, they know you to work, and everybody says how lovely you are, how nice you are. And there was this little, but this is for real. I mean, I'm not actually saying that, this is for real. Everybody says how lovely you are, how nice you are, and so it's actually it's so lovely to talk to you like this, because everybody has just nice things to say about you, so that means quite a lot. And I guess as well, that's why you becoming what you're becoming. You're teaching your classes, your conferences, and you're a speaker. And I guess all these beautiful things happen because it's the energy that is how you're reflecting your energy on people.
Thank you.
So I'm happy that we have had this podcast and this conversation, and I truly mean it. I'd love to be your coffee eventually.
Yes, absolutely. Absolutely. I must say, you need to speak to my other half, because I do have the ability to be very moody, and I can be very miserable sometimes, and I can be very sulky, like with the mouth like hanging on the floor. Yeah, I can be that guy. So
can we all? I mean, can we all? I mean, everybody, but in general, like people that work with you. I spoke to a few people that know you at work, and everybody, the few people that I spoke to, everybody says that you're just a nice guy, which is a lovely, lovely thing to hear from people on the outside.
Thank you. It's also very nice in our industry that where we are now, we can actually get support and we can help each other. Because, for example, if there's and I have helped practitioners. I've had practitioners help me. You're running out of a product, or there's a patient, you just need a fresh pair of eyes to have a look at this patient when something's maybe not 100% gone the way you wanted it to. And that's very, very important. We have that in our industry now, and I think that we have to nurture. We just have to, because ultimately anything that we do, our patients are safe no matter what. That is our top priority. And if there's a network of us looking after them, then by all means, our specialty progresses, our patients are safer, we produce better quality results, better treatments. So thank you.
Thank you so much.
Awesome, thank you.
And I will be seeing you soon.
We'll see you soon, absolutely, definitely. So thank you, ciao. Thank you, everyone. Thank you. Bye.
Please do not forget to like and subscribe. And stay tuned with us for the next episode.